An exercise stress test is used to determine how well your heart responds during times when it's working its hardest. During the test, you'll be asked to exercise, typically on a treadmill, while you're hooked up to an electrocardiogram (EKG) machine. This allows your doctor to monitor your heart rate. The exercise stress test is also referred to as an exercise test or treadmill test. Who and why should have an exercise stress test? An exercise stress test is primarily used to help your doctor determine if your heart receives enough oxygen and proper blood flow when it needs it most, such as when you are exercising. A healthcare provider may recommend a stress test to diagnose coronary artery disease. The coronary arteries are the major blood vessels that bring blood and oxygen to the heart. Coronary artery disease develops when these arteries get damaged or diseased. Cholesterol deposits in the heart arteries and inflammation usually cause coronary artery disease. Diagnose heart rhythm problems. A heart rhythm problem is called an arrhythmia. An arrhythmia can cause the heart to beat too fast or too slowly. Guide treatment of heart disorders. If you've already been diagnosed with a heart condition, an exercise stress test can help. Your provider knows treatment for you. Check the heart before surgery. A stress test can help show if surgery, such as a valve replacement or a heart transplant, might be a safe treatment. If an exercise stress test doesn't show the cause of symptoms, your provider may recommend a stress test with imaging. Such tests may be years old, or if you have other risk factors for heart disease, you should talk to your doctor to see if risks of an exercise stress test. Stress tests are generally considered safe, especially since they're done in a controlled environment under the supervision of a trained medical professional. However, there are some rare risks such as chest pain, collapsing, fainting, heart attack, irregular heartbeat. However, your risk of experiencing these reactions during the test is low, since your doctor will screen you for problems beforehand. People who are at higher risk of these complications, such as those with advanced coronary heart disease, are rarely asked to do the test. What are the different types of stress tests? There are many methods for assessing heart function while it's hard at work. All cardiac stress tests involve checking your heart rate, blood pressure, oxygen levels, and electrical activity. But there are some differences. Stress test types include walking on a treadmill or riding a stationary bicycle. A well-trained exercise physiologist usually tailors the speed and elevation of the treadmill to your ability to walk and your overall fitness. If you can't exercise, you receive medications that make your heart pump harder and faster or captures your heart's electrical activity. Exercise stress tests check for signs. Exercise stress echocardiogram. An exercise stress echocardiogram is similar to the basic stress test, but provides more detail. Healthcare providers perform an echocardiogram, ultrasound of your heart, before and at peak exercise. This cardiac imaging test uses sound waves to evaluate. You might need a stress echocardiogram if the results of your initial stress test are unclear. This study enables healthcare providers to observe blood flow through the heart's chambers as well as the effects of exercise. Nuclear stress test. This advanced heart stress test uses safe levels of a radioactive substance and pictures of your heart before, at rest, and after you exercise. A cardiologist compares the amount of blood flow to the muscle of your heart at rest and after stress. A decrease in blood. Nuclear cardiac stress tests can determine the severity of blockage of coronary artery disease. Assess whether previous treatments, such as stents or bypass surgery, are working as they should. Help you avoid more invasive heart tests, such as cardiac catheterization. Show whether your heart. If your healthcare provider recommends cardiac rehabilitation, the program may include stress testing. Rehabilitation is a medically supervised exercise program that helps people with heart disease become more physically active. Cardiac rehabilitation stress testing includes exit stress test, enables the team to measure your progress and create a long-term exercise procedure. How long is a stress test? If you're undergoing a basic stress test, the exercise portion lasts about 10 to 15 minutes. Additional time is necessary for getting ready to exercise and recovering afterward. Stress tests that include echocardiography, nuclear imaging. Do I prepare for an exercise stress test? To prepare, you should not eat anything in the hours leading up to the test. If you're having a nuclear stress test, you might not be able to eat until after your test. Avoid caffeine for 24 hours before testing. Not smoke or use tobacco products. Stop taking certain prescription medications the day of your test. These include beta blockers and asthma inhalers. Talk to your healthcare provider before stopping any medications. Try to relax. It's natural to be nervous about heart testing shoes. What happens during an exercise stress test? Here's what to expect during an exercise stress test. A technician takes your vital signs, including your resting heart rate and blood pressure. They attach small, sticky discs, electrodes, to your chest and arms. The electrodes connect. Over time, the pace becomes more intense, but still manageable. Technicians and exercise physiologists periodically ask how you are feeling. The test ends after maintaining your target heart rate long enough to capture readings about heart function, usually about 10 to 15 minutes. Your target heart rate if you experience severe symptoms or ask to stop. What happens during a stress echocardiogram? You follow the same steps as an exercise stress test. In addition, you lie down on a table before and after exercising to undergo an echocardiogram. This imaging study uses sound effects of exercise in more detail. The whole test takes about an hour, but you exercise. What can I expect with a nuclear stress test? For a nuclear stress test, you receive an injection of a radioactive substance. There is enough substance to show small details of heart activity during a sophisticated imaging study, SPECT or PET scan. The level of radiation is low and isn't associated on a treadmill or stationary bicycle. If you can't exercise, you'll receive medication to make your heart work harder. After exercising, you undergo an additional scan. A PET stress test can usually be performed in around 30 minutes. The test usually takes 3 to 4 hours, but you exercise for stopping the test. Healthcare providers monitor your symptoms, heart rate, blood pressure, and ECG until it returns to a normal range. This takes about 15 minutes. Results and follow-up. What do normal stress test results mean? If the results are normal, your heart is pumping as it should and there is adequate blood flow. What this means for your health depends on why you underwent stress testing. Heart disease evaluation. Symptoms are not due to a heart issue. Experience chest pain and a racing heart even though their heart is healthy. Exercise or surgical planning. Your heart is healthy enough to start an exercise program or for you to undergo surgery. Heart disease monitoring. The treatments you are receiving are. What happens if my exercise stress test results are abnormal? Abnormal results may mean you have heart disease. For signs of mild heart disease, healthcare providers may recommend lifestyle changes, like smoking cessation or an exercise and weight loss program, and medications to treat your diabetes, blood pressure. The test or affect large segments of heart tissue. Additional tests may be necessary. These include cardiac catheterization, CT coronary angiography, nuclear stress test, stress echocardiogram. Abnormal results may also mean your heart is not strong enough for exercise.